Hi, good evening. Steve Adler. Hey, you got a minute? We're going to go through the numbers so we can see what those are. The governor had a press conference today where he talked about opening some things up. So we're going to talk about that and changes in the governor's order and the decisions that then have to be made locally. But let's begin with the numbers. We'll go to the dashboard we ordinarily go to. 12 is the number of new admissions, still bouncing around in that area. The 7-day running average at 13. 3 times we've gotten that 7-day running average down to 12 here. Each time it's bounced back up. We just can't seem to get below 12. The key to being able to do that is wearing masking. That's what drives down that number. It's what drives down infectivity and positivity rates. If we're going to open things up, if we're going to keep schools open up and sustain that, we have to get the numbers down. But you can see that that's still pretty flat there when you look at the graph. Number of new cases today, 45. And again, we just seem to be bouncing around there between 40, 45, and 125-ish. 7-day running average, 69. So we're below that today. But we were at 95 yesterday, so that number seems to be bouncing around. Still a relatively younger group than what we were seeing several months ago. Let's go ahead and look at the next page. We'll take a look at the green numbers on the next page. It'll tell us how we're doing with hospitalizations. We have 79 people today in our hospitals. The 7-day moving average, 79. So we're right on top of that number. Again, indicating flatness. Numbers in ICU, 27 tonight. In the ICUs, 26 is the 7-day. So we're one over that, basically flat. Ventilators, 7-day moving average went down to 14. We have 18 tonight on ventilators in our hospitals. Not good news, still relatively flat. The 45 new cases that we have today kept us under 30,000 total cases. We're 29,997. Tomorrow we'll go over 30,000. We don't do Got a Minute on Thursdays, so I won't be with you tomorrow night. Thursdays when we have council meetings every other week, but we don't do them on any Thursdays. So tomorrow when we pass 30,000, won't be with you, but anything over 2. We will have gotten to that mark, and we'll talk about it when we're together on Friday. 436 people have passed away. That's 2 more than what we had yesterday. Still a very real and serious illness. All right, so let's talk briefly about the governor. Excuse me, the governor. Issued a new order today, introduced a video, sorry about that, beginning on October 14th. Businesses like amusement parks, movie theaters, zoos, aquariums, bowling alleys can expand up to 75% occupancy in counties where there's a relatively low COVID hospitalizations. We would qualify for that. Businesses that were limited to 50% can now move to 75%. That includes folks like amusement parks and bowling alleys, bingo halls, movie theaters, water parks, and zoos. So they move up at that level. The governor also said that outside groups of any size can get together so long as they follow the other rules, which are the gathering size, keeping it below 10. You can go above 10 if the mayor allows that. Otherwise, you have to be in those pods or group of 10. I haven't allowed that over 10. So still trying to maintain those groups, to drive down the numbers. Then the question comes up to bars. The governor said in his press conference and in the press statement I'm reading from that bars could open, he said, after October 14th with a 50% occupancy. but it's going to require county judges will be able to opt their county into opening bars so long as they assist in enforcing the health protocols. The governor was quick to add that opening up bars does not mean that COVID is no longer a threat, and that most Texans are still susceptible to the virus. He didn't talk at length about the need to wear masks. I wish he had. He has in the past. Masking is still real important. The governor didn't do anything to say he was moving away from that, just didn't get the prominence I wish it did, because there's nothing that we're doing that's having the impact that masking will. So the question with respect to bars is something that's going to be discussed both here and in other counties and cities around the state. I don't know that it necessarily means that bars will open across the state on the October 14th day. I think there's going to be some consideration looking at each county, what's going on. AISD just opened up. Could be that Dr. Escott wants to make sure that there's no spike. It could be that he ties opening bars to or his recommendation to the county judge that it be tied to certain positivity numbers. Don't know. That's the kind of thing that's going to have to be discussed. Could be that they discuss kind of like additional kinds of rules. A bar can operate, but maybe we do things to encourage outside activity. Maybe big bars are treated differently than the neighborhood bar that has 10 people in it. Maybe there are rules that say in a bar, just like in a restaurant, you have to be seated in order to be able to drink. So there's not aggregating or milling about. Maybe there's no drinking at the bar itself. You have to be at a table. Who knows? But those are the kinds of things that are on discussion. So both the timing, the protocols associated with those. The governor had some that he's posted, whether locally in different areas, they'll ask for some more. And then how do we do enforcement? That's probably going to be discussed as well. So pay attention here over the next several days, over the week. I would imagine that the county judge will get information and advice and suggestions from people, both the experts and the industry. So stay here, and we will we'll fill up on that. I want to remind everybody to get a flu shot. And here is a link for you. Get your flu vaccine, austintexas.gov/flu. austintexas.gov/flu. Everybody needs to do this. Even if you're among the people that haven't done it in past years, do it this year. One of the big risks and potential challenges on our horizon that could appear is a outbreak of the flu at the same time that we're watching the spike in COVID, in which case we are in just a world of hurt. Some things are within our control, some things are not. And we need to, with respect to the vaccine, we need to take it so as to increase the chances that we have a very slight case of the flu. Remember last year, the flu filled up our ICUs just by itself. Don't anticipate that's going to happen this year, because I expect a lot more people to actually get the flu vaccine. And also we're masking. So the things that we're doing to stop the transfer of COVID-19 should also help us with the flu. People paying more attention, not going out when they're not feeling well, not going out when they're sick. That should help us with the flu, but it begins with people taking the vaccine. The more I hear people talking, I don't think anybody knows for sure about vaccine for COVID-19. The more that I hear from people, I think it's unlikely we're going to see a vaccine before the election. I think there's probably a good chance that all of the experts and all the scientists sign off on not just one, but multiple vaccines, either in kind of a late December, early January timeframe, somewhere in there, and that the vaccine actually then starts showing up. It's going to take a while for production to reach a high enough level for everybody to get it, but we could have anywhere from 3 to 8 different vaccines that are available early next year. I tell you what, I'm hoping at this point that there's enough vaccine for everybody. We can get out to everybody by the end of springtime. and that would be my guess as to what's on the horizon. That between that kind of January, February timeframe and the end of spring, people start getting vaccine. With that said, you all take care. I will see you on Friday. Be safe and good night.